so many miracle stories and miracle cases with kids because their brain is just soaking it all in, and just you see the most amazing changes. And every day you see a miracle case, and I'm sure you're the same. You see that in practice as well, and it's so empowering and it's so beautiful to watch. And it's sad that so many kids are missing out on this because chiropractors are confident in seeing kids, and that's what we want, is just more chiropractors being confident in there and clear in what they want to do with patients and kids, so that we can get more kids under chiropractic care. That's our goal.
Hello, and welcome to Build Your Remarkable Practice podcast. This podcast is dedicated to chiropractors who are in the seasons of launching and building their practice. Join myself, Dr. Lona, and my co-host, Dr. Bobby, as we have conversations each week as it relates to building the practice of your dreams. And remember, you can have a remarkable practice as part of a remarkable life, not instead of one. We're here to lead you on the way.
All right, welcome back to Build Your Remarkable Practice podcast. And today we are going to be joined from two guests from down under. And we're going to enjoy not having Bobby being our great voice this time, but we're going to have Dr. Bree and her sister, Dr. Hayley, who have a lot to talk about as it relates to growing your practice, bringing more families into the practice, and seeing kids. So welcome to the show, you two. It's great to have you on. Thanks for being here.
Thanks. We're excited.
So let's jump right in. Yeah. So I'll try and pitch it to both of you here, but tell us a little bit. We have a connection in that you guys are the founders of the Remarkable Kids program. And so before you tell us much about that, why don't we jump in and just tell us a little bit about yourselves? And you have quite a remarkable practice that's been a long-standing remarkable practice. So just tell us a little bit about who you are as chiropractors first.
Yeah, so we're from Australia, and we're chiropractors from Australia, and we work together with our dad in just outside Melbourne, and we have a practice that we run. We've got 7 chiropractors that work with us. It's a very family practice, very family-orientated chiropractic business. It's been there for over 40 years, and we see over 60% kids is our patient base, and our focus is purely on families and pediatrics and helping families achieve their optimal health and wellness through chiropractic. So it's an awesome practice, and it's very busy, buzzing with kids. Yeah.
Awesome. Okay. And Dr. Bree, anything to add in there too?
I think, Hayley and I, so our dad started the practice, and we grew up as with chiropractic being our healthcare. We became chiropractors so that we could help more kids and families. We didn't know there was an even option to be a chiropractor and not see kids. Like, it was just ingrained in us from the start. We grew up really healthy and confident, thriving, and we put it all down to chiropractic. So we became chiropractors to offer the same to other kids. And then we were surrounded by it. We grew up in the practice with dad being our mentor. And so, we see hundreds of kids in practice every single week. We have our practice is really well known throughout our local area. We get referrals from pediatricians, maternal health nurses, like really amazing referral base because of the amazing results and respect we have through the community. But despite seeing hundreds of kids every single week, it's not enough. We want more chiropractors seeing more kids, and we know that around the world, unfortunately, chiropractic students are not getting the education they need to see more kids confidently from the get-go. And that is a worldwide thing. Not Australia's pretty poor as well, but it's worldwide. Our students are struggling. So we created our platform and then joined with Remarkable Practice as Remarkable Kids to try to offer as much support to get more chiropractors confident in seeing kids, so that we can help more kids worldwide, because we're doing our best in our little community, but we want to see more kids under care around the world.
Yes, that's beautiful. And you guys are proof is in the pudding that you are children that grew up in the chiropractic paradigm, chiropractic lifestyle, clearly being adjusted. And like what you just said there of like, we didn't even know that was an option to not see children in the practice. The normalizing that chiropractic is, I like the words womb to tomb, like a true family practice sees people from, the second they became an idea to have a baby to then, grandma and grandpas and great grandmas and grandpas, like to me, that's true family practice. And so, when we think about what holds people back from having a family practice that is seeing the mamas and the pregnant mamas and the babies and the toddlers and all of that, I do think there is a sense of sometimes people, especially if they don't have kids themselves, they don't know how to communicate the value, or they don't know how, they maybe do need different skill sets to look for, like, how am I assessing a child's spine? So talk to us a little bit about how you guys, especially, you're in practice 6 and 10 years, like how you developed not only from knowing it was the right thing, but then clinically being able to like deliver adjustments to any size practice member.
I think we were very lucky. Obviously, we had our dad who is a pediatric chiropractor as well. And so we were learned and observed through him in the practice that we now run. And we spent hours, watching him adjust, 1-day-old babies, kids with plagiocephaly, kids suffering with ear infections, whatever it is. And so we had that confidence from the get-go. But I think what stops a lot of new grads especially is fear. And it's the fear of the unknown of what do I do, or what am I going to do, or how do I do it? And that is part of the reason that we created the platform and Remarkable Kids, is to get people on board and over the fear that they may have created within themselves. And it helps with the communication of how to communicate to parents what you're going to do and how you're going to do it, so that parents understand chiropractic how we understand chiropractic, because then there's no fear when they do.
Yes.
And also building the confidence of new grads, but not necessarily new grads. It may be people that have been in practice for a really long time and want to branch out into that family practice as well. But we also give and go through and train other chiropractors on little steps and little things that they can start to implement, so that if they are faced with a 1-day-old baby, they know exactly what they can do, and they will help that child, even if it's simple, even if it's really simple, but techniques that will help build confidence. Because I think it really is fear that's stopping a lot of our profession from seeing kids and seeing hundreds of kids that really need chiropractic as well.
Mm-hmm. Yeah, I think
yes.
I think that our platform, is created with in mind that, like, when we graduated, we were confident. We talk about that all the time because of our dad and because of the courses we did during university. We saw kids from day one. My first day graduating, I was seeing 5 new patients, and they're all kids that day. So from the get-go, but where our platform and how we support other chiropractors comes in is because every week in practice still, we have friends that we graduated with, or friends that were older than us at uni, calling us and saying, help, I've got a kid coming in today. What do I do? And we take them through, okay, do this basic examination, ask these basic questions, and then do this adjustment, and you will help this child. And we just want chiropractors to be confident in the moment, which is not why Remarkable Kids is not a course. It's not designed to go from start to finish and tick it off, or sit down one weekend and just go through it all. It's actually designed as a resource to help chiropractors in the moment, because we know that TRP docs, many of them are already seeing heaps of adults, and we want them to be confident enough with the support of Remarkable Kids to be like, okay, why don't you bring your child in tomorrow and I'll get them checked? And then not have to do a 200-hour course to feel confident enough, because they have Remarkable Kids and go figure out exactly what they need to do for that appointment and walk in confident. And then how confidence comes from there is just experience, getting your hands on more kids, seeing more kids, and seeing how easy it is to really help kids. Like, it is the most rewarding part of our career, seeing these kids, and it's so much easier and it's so much more fun adjusting kids.
You see so many miracle stories and miracle cases with kids, because their brain is just soaking it all in, and just you see the most amazing changes. And every day you see a miracle case, and I'm sure you're the same. You see that in practice as well, and it's so empowering and it's so beautiful to watch. And it's sad that so many kids are missing out on this, because chiropractors are confident in seeing kids, and that's what we want, is just more chiropractors being confident in there and clear in what they want to do with patients and kids, so that we can get more kids under chiropractic care. That's our goal. That's our goal.
Yes.
Because often we have every single week, I reckon we have parents bringing their kids in and they're saying, oh, I've been to chiropractors for years and no one has ever suggested I get my kids checked. And that breaks our heart, and it gets parents really mad. Why has no one suggested this before? Why has no one told me this before? My kid has suffered for years. My kid's on medication, and parents want to know this stuff. They need our support, and we believe that all children deserve the right to see a chiropractor, no matter what practice their parents present to. Just because they're presenting to a chiropractor who doesn't specialize in peds doesn't mean they shouldn't be getting suggested they get checked. Chiropractors should be confident enough to suggest it, to check the child, and if it is outside their scope, to be able to refer to a chiropractor who does specialize in that condition, etc. But there's a lot of kids who don't need a lot of specialized treatment. They just need chiropractic support. They need improved input to the brain. They need subluxation adjustments. Like, it's so simple, and chiropractors just need to feel more certain and confident in their in that. Yeah.
So we talk about this a lot in my team, because we have one of our practices is 100% in the schools, right? So our patient base is 80%, 90% kids from the age of 5 to 18. And we realize that in the parents that are signing these children up for care, like they're, especially when the school sends something home, like, hey, your child has an opportunity to have chiropractic at school, and that parent is looking for answers, they're very open to what we have. They just don't know it's called chiropractic. They don't know that chiropractic is the solution they're looking for. So I agree with you guys 100%. And I also agree, you said something earlier, where it's very much like that what holds most of us back is fear, right? And I think there's also this, we're not deeply rooted yet of like chiropractic is what we're looking for. And that principle of what chiropractic stands on, it is like trust, learning how to trust the body, to listen to the body, to, that element of learning trust again, right? As a clinician, but then also you're witnessing it in your own family too, which makes you an even better able to understand what parents are going through and teach them how to trust their children's bodies. Right.
Yeah, 100%. Yeah. It is. It's
awesome.
Yeah, it's amazing watching kids trust what they're doing and how they're growing up, and also parents, like you said, learning to trust their kids' instincts as well. And it's, they don't necessarily know that chiropractic is what they're looking for, but when they find it, it's like that light bulb moment of, oh, this is what I needed and this is what my kid needed. And it would be cool if so many more kids could experience that. Yeah.
Yes. And I think we're creating that. That is going to happen. You guys have a vision for it, and you're doing something about it. So talk to us about like what's in the course. Like if someone's like, I know I need something that's like, I want to feel more confident, or I want to feel like I'm teaching more of my patient base about how chiropractic could benefit any age of their family member. Like, what's in the content? What can they expect out of the content?
The biggest feedback we get about Remarkable Kids is just how much is in it. People are so amazed at how much we can fit into one platform about kids. I think an important point to cover is that we cover everything you need to know. So we believe there's like 3 main essential elements to being confident, see more kids, to build a thriving family-based practice. And that's what we're doing here. We're not trying to make you a pediatric focused practice if that's not what you want. We just want the regular day-to-day chiropractor seeing more families. And that's what our platform does. That's what Remarkable Kids does. So we cover the 3 main essential elements, we believe. The first one is clinical excellence and confidence. So we cover every clinical skill you need to see kids. So we do a thorough examination for babies and toddlers and older kids, including every neurological exam, every developmental exam, spinal exam, orthopedic exam, anything you need to know to examine that child, no matter the age. And then we go through every single adjustment of every single segment and different techniques for all those segments, whether you're manual, drop piece, activator, Logan, low force, craniosacral therapy. We have all the techniques for you guys to be confidently adjusting kids and doing it with certainty and the support of the platform. So we cover the clinical side, including the management. So we are very clinically relevant, meaning if a child's coming in with ear infections, go to this part of the platform, read about how to describe it, what to examine, what we schedule, and how to adjust that child. And we do that for irritable baby, colic, reflux, plagiocephaly, bedwetting, constipation, toe walking, tongue tie, all the conditions that we know that if you are going to start seeing more kids, you're going to be presented with these conditions, age-specific conditions. And we want you to feel confident even if you've never seen a child with bedwetting before. So go to that part of the platform and go, this is what I need to do. We then cover the other 2 essentials, which is practice, procedures, and structure, how to set up your practice, how to set up your appointments, report appointments, re-exam, or day 1, day 2 re-exams, wellness visits, all the types of appointments that you need to set up child specific, including the paperwork you need for that as well. And then we have team training. So you're not going to see more kids if you have CAs at the front, not sure why you need to see kids. So if patients are asking, oh, your CA, should I bring my kid in? And the CAs are saying, I guess if you want, like, that's not what we want our CAs to say. So we have scripts for the entire team, for associates and chiros and CAs on every appointment, every hard question you're going to get about the safety of chiropractic. What's the chiropractor going to do? Are they going to crack my baby? Every answer you need your team to be trained in and trained in, we have within the Remarkable Kids, because we know you could be the most amazing, clinically amazing adjuster for kids, but if your practice systems and your team is not set up to support kids and families, then you're not going to be successful as well. So we cover all of that in depth, and you're able to jump in wherever you need support that day, whether it's team training, whether it's that practice appointment, whether it's adjusting clinical skills, whatever you need that day, you can jump in right to the point you need.
Yeah, that's beautiful. I love that part where you have listed out like these different common symptoms or common presentations and how to clinically like know how to handle that.
That's actually my favorite part.
I actually had a
program. Yeah, that's my favorite part of the program. It's amazing. It's like you can go to, our associates will have it on the back computer in our office, and they'll just go to that section when they need to brush up, or maybe they haven't seen a kid with toe walking for a while. So they're like, you know what, I'm just going to go to that part and just brush up my skills of it. And our associates use it every day. It's just constantly, the program's on our back computer, and it's perfect for associates and for teams to build that confidence going into the room for everyone.
Yeah, that's excellent. Someone had asked me last week, because they were coaching with us, and they said, I want an example of someone actually laying out a report of findings for like a 2-year-old. And I need to direct them to come look at everything you guys have already made. So
yeah,
that's beautiful. Okay, in closing thoughts here, as you guys have lived this for your entire childhoods, and now are delivering this to many, many more people, and then also teaching it, like, what is your hope, as you look out, maybe especially in this like last 3 to 5 years, where I think there's more and more people who are searching for chiropractors who are teaching these type of things. Like, what do you think is, our opportunity right now as a profession for humanity?
Well, we have quite a big goal within our platform, is to have every kid in the world under chiropractic care. And so every step.
Oh, I love it. That's a huge goal.
It's a big, audacious goal, and we know that. But, every step we do, every seminar we do, every bit of content we create, every podcast we do, everything that we do, every seminar and speech is to inspire more chiropractors, no matter where they are in their journey, whether they've been out for 50 years or they're about to graduate, is to see more kids. And I think more kids at the moment are more sick than ever before. And they are, like you said, Lona, searching for answers that Western medicine is not providing for them. And they're searching for chiropractic. And I just think that chiropractors need to just be open to what perhaps you don't know, because you don't know what you don't know. And I think a lot of chiropractors think that seeing kids is hard work, and seeing kids is exhausting, and someone else can do it. But we need every kid in the world under chiropractic care, and that requires lots of chiropractors to see kids. And so I think we just want to inspire chiropractors to be open-minded with what they can learn, and to search for answers, and to know that you don't have to know everything, but just be open to the fact that kids need chiropractic and they need our help to get healthier and to have better lives. Do you have anything to add to that?
We just want more kids under care, and we want chiropractors seeing those kids well, because we know there's a lot of chiropractors who are going to be listening to this right now thinking, oh, I see kids, but we know you're guessing, and we know you're winging it. And we know kids deserve better as well. So kids are sicker than ever before. Parents are searching for more answers that are aligned with chiropractic. So we need to get more chiropractors confident, certain, and stop guessing, stop winging it. Set up your practice, your skills, your team to support every step for these families, so that we can get entire families under care. we look at our stats, we know that if a whole family is under care, they are so much more likely to be under chiropractic care in 5, 10, 15, 20 years time. We have literally 4 generations coming into our practice. We've had people coming into our practice for over 40 years. They're bringing their kids in when they got adjusted as a baby at our practice. Like, we know that if your patients or your clients know or getting their kids checked, then they understand chiropractic. If they're not getting their kids checked, then they're not going to be under care in 2 years, 5 years, 10 years time. You need families under care to build a lifelong family practice.
Yeah.
Yes. It's great advice and a huge vision. And we have a lot of work to do in sending people to chiropractic school if that vision's going to come true as well. Just, you guys got your work cut out for you, but I'm working with you. So I love that. And I love also the context too of realizing, our nervous system, having an adaptable and resilient nervous system with all the demands that are on the average child at this point. It is that just feeling empowered of like, why does the child need chiropractic more than ever, is because look at, what's coming at the average, child as well as just human right now, and just the amount of demands, whether that's chemically or stress of just day-to-day living and all the devices we're on and all of that. So there's just so many reasons why having the leg up that chiropractic offers anyone, not just a child, is more important probably than it ever has been at this stage.
Yeah.
Awesome. Well, thank you, ladies. Maybe in the show notes for sure, we're going to drop a link so that if you're interested in checking out Remarkable Kids, you can find that. And then what are your guys' social media platforms, or how can we find you if someone wants to follow the work that you're doing and your mission?
We're just about to set up a Remarkable Kids Instagram page, so we'll add that in the show notes as well. In Australia, we're known as Elevate Pediatric, so you can jump onto Elevate Pediatrics, find us there, and our Remarkable Kids Instagram page as well.
Beautiful. All right. Thank you so much for your time, and I love your mission. So keep up the good work.
Thank you.
Thanks for having us. Thanks for having us.
Hey, Remarkables, let me ask you, can you imagine generating more than 600 qualified new patient leads per month? How about seeing 183 new patients in 1 month? Imagine your practice generating more than $100,000 a week in collections, on track to doing over $5 million this year. Sound impossible? Well, those are the real results that TRP's own Dr. Bobby Ilyajozovic is enjoying as we speak. Those are his July numbers, and August is going to be even better. Coach Bobby has been a new patient generation machine for nearly 10 years. I know, because I've been coaching him since day one, but now he is going totally bionic. He has cracked the code on new patient generation, and he is ready to share it all with you guys. Do you want to get in on this? Join us for the annual Remarkable Attraction Marketing Immersion, October 10th and 11th in Phoenix, Arizona, and October 24th and 25th in Adelaide, Australia. Coach Bobby will be walking you and your team through every step of his Remarkable Lead Machine system. Click the link in the show notes below and register your team now. But Dr. Bobby's sessions are only one of the reasons that you and your team need to be at the Remarkable Attraction Immersion. Let me ask you, have you started using AI to drive new patients into your practice yet? There's a new era in marketing that's powered by AI, and it's creating a surge of new patients for docs that know how to leverage it. Don't miss this wave. Our team of experts will show you exactly how the most successful marketers are using AI to generate record numbers of new patient leads in internal marketing, external marketing, and of course, digital marketing. Have you developed a fully leveraged marketing machine where you'll have total confidence that you'll predictably smash your goals month after month after month? Stop leaving tens of thousands, if not hundreds of thousands of dollars on the table due to lackluster internal new patient referrals. Stop wasting time and spinning your wheels trying to figure out how to get butts in seats for your outside speaking events. Stop throwing good money after bad on digital marketing that's just not working. Doc, you should be seeing a 5 times to 10 times ROI on your marketing dollars. Our clients are crushing this. This weekend seminar will feature a 3-track format focusing on optimizing your internal, external, and digital lead generation. 9 breakout sessions in total, with a special emphasis on best practices leveraging AI for all of them. Bring your team. Everyone in your practice is a marketer. Let us inspire and equip them to help you fill your schedule book with more qualified new patients. Join us for the annual Remarkable Attraction Marketing Immersion, October 10th and 11th in Phoenix, Arizona, and October 24th and 25th in Adelaide, Australia. Click the link in the show notes here or go to the remarkablepractice.com events page and register your team today.
Hey everyone, please listen in for this next bonus interview of one of our remarkable success partners. They all help us help more people find the benefits of chiropractic. So listen on.
Hi everyone, we have the very special guest today, Dr. David Fletcher from CLA, an amazing man, a good friend of TRP, a good friend of mine. So David, do you want to introduce yourself?
Yeah, absolutely. Malcolm, it's going to be in the most interesting 10 minutes of anybody's life here because they get to listen to what we usually talk about. But anyhow, it's wonderful to be invited and to be a part of the TRP family. We relish every moment at CLA that we get a chance to, interact more closely with TRP clients. And I think the real reason is that when we take a look at the values that drive both of our companies, there's really no separation at all. We finish each other's sentences, so it's a wonderful experience.
That is for sure. You've been personally. I've used CLA your services since 2000, so 25 years. I've been a CLA client, integral part of my practice. A lot of the listeners, most people would be aware of CLA. But what I really want to know, and I know what our listeners want to know, is what are the problems you actually solve for a practice?
Well, I think one of the most important things that we focus on and really use as a solution for everyone, it's not even a style of practice, it's for everyone, is what we could determine or call the critical shift. Is that there's this moment in a chiropractor's experience and a patient's experience of where you have to take it beyond what their expectations are in the delivery of your care. We know that the vast majority of people entering into a chiropractic office aren't coming in and saying, arouse my innate. What they are saying, is, I have a problem. And so we need to convert those people to hear our story. And one of the things that matters, and what chiropractic has always been about, is looking deeper into the nervous system. Right from the very start of the origins of our profession, we talked about the tone of the nervous system. And so scanning really opened that door. It didn't dismiss X-ray, it didn't dismiss orthoneuro tests or anything like that. It just said, what if we could look into the functioning nervous system? What if we could track that, and then we could solve the problem of developing responsible care plans, communicating to our patients the positivity of what it is. And really it comes down to attraction, retention, and conversion, which is why I said we are TRPites when it comes to that.
So let's get specific here. And I know that CLA helps in all areas of practice through attraction, conversion, retention. So how specifically does it solve people's problems if they're having attraction problems? How does CLA solve that particular problem?
I think it usually begins with somebody, a parent or an adult, coming in to have the first visit, and it's going to be pain-based. It's going to be, I have a problem, because we haven't oriented them otherwise. And they start to realize that you as an examiner, you as a team, have the ability to really listen to them, but take the whole examination and reporting process deeper than what they thought. And so you set the stage for them to hear the story that you want them to hear, which is about, when it all comes down to it, the problem we really all face is conversion to a lifetime wellness patient. Let's just say that. We know that that's a dream, but we also know that it's a reality. I could look at your practice and I would see that the retention that leads to that, not everybody stays for a lifetime. You and I did. We became chiropractors. But the reality is that it opens doors, and it's an invitational model. So that's the number one thing. It brings highly visual. Well, you taught me this, is that it makes the invisible visible. Yeah. It allows the patient to have a clear understanding of what you are directing your attention to, and it vividly displays it in color and in scores and in trackable metrics.
Yeah. I mean, it's one of the benefits, and we know that 70% of the population are primary visual. So that when they can actually see on a screen, on an iPad, or whichever way you deliver the reports, which the amazing inroads that CLA has had over the last, I don't know how many years it is, going from very wide machine to these wireless machines and now to the iPads, and the reporting is just amazing. So when they can see it, when they can see how their nervous system is functioning, how does that, I mean, I know that it improves retention, hands down, the conversion process. So how does it specifically solve the problems of conversion retention?
Well, conversion and retention is really easy because now you're not using plan, can, ham, care planning. You're using the exact data that is presented to you in terms of a three-dimensional neurofunctional exam. We're looking at heart rate variability to get a global picture of what their stress and adaptability are. We're looking at their postural energy expenditure using EMG, and we're looking how deep it's going with their thermography. We build a complete model, or a report card, really is how we describe it, a report card called the core score that allows the patient and the doctor to have a trackable and identifiable goal. And
Yes.
I mean, who doesn't want a goal? And so we allow the patients to get on this journey of saying, first we have to release the tension, then we start to build new strategies. And instead of it taking a day or two or a week or so to feel better, we have a plan that we can put in place with it that originates with their initial problem, but can take them several months down the way, and as we know, several years down the way.
Yeah.
That's the retention conversion. You did ask about attraction, and I didn't really finish that because I got off on
on a tangent.
But you know, almost immediately, this is one of the most interesting things we see, and I know you can comment to this, is that we see the immediacy of family members coming in. Almost immediately when a parent is scanned or a grandparent is scanned, they are so enthusiastic about wondering what a well-child checkup looks like. Remember, we're not into the pathology business, we're into the possibility business. And so when a parent sees that they'd like to have a child scan, I mean, how else are you going to examine a child's nervous system unless you're scanning them? And so they want a baseline. They want to know that before their child gets sick or before performance becomes an issue, that they have a baseline in place with you.
Yeah. And it's that baseline. I know personally in my practice, and as I said, been using for 25 years, what I realized is that the people that I thought were getting better, as in their symptoms were getting better, when I scanned them, I realized, yes, their symptoms are better, but their nervous system is improving, but it's got a long way to go. And that's the retention thing you're talking about. So I found that my retention jumped massively when I started using CLA all those years ago. And it is an integral part of my practice.
And, you know, it takes a lot of stress off of the clinician, off the chiropractor, because first off, you're building the conversations not on what is good for what they might perceive as the practice, but is really good for them. And, you know, one of the things that we know is that they need chiropractic care at a certain level. We know that, and we can track that. But there comes a time when they now can move away from needing it, like intentionally needing it, to where they can choose to be inviting themselves into it.
Correct.
And, you know, when we take a look at these emerged practices like yours, and I mean, we have thousands of offices around the world, so we know exactly what we're doing here. We see practices that were the average practice of the people we're talking to is what we would refer to as a 20-80 split. 20% of, pardon me, an 80-20 split. 80% of the early starts and the practice volume in a symptom-based practice is indeed short-term symptom-based. But we see the flip happening, that only 20% of people in a practice, of a mature practice that has built scanning and built the idea of retention into it, actually are just learning to become part of the 80%. In other words, that there's this natural progression from needs being met to being invited into this long-term better strategy called vitalism.
Yeah. And this is, yes, we talk conversion, and a lot of time, effort, energy is put into that conversion process, the initial one I'm talking about.
Yeah,
so your day one, your day two process there. Then when you're looking at re-exams and doing this, and you mentioned goals before, I remember one of our patients in their practice, their actual goal was to improve their core score. And that was their goal. They said it. They said, I want my heart rate variability to be this number. That was their goal.
Yeah.
So as far as re-examinations and that continuing process over time, how does it really assist people to give them a pathway beyond that?
Well, we instituted something that I glamorously refer to as a rule of 12. And basically it says that when we're building care plans, it's our responsibility to report back to the patient at least every 12 visits.
Mm-hmm.
And so every 12 visits, we set in a cycle where an examination must go. And let's just say that the patient's down to every couple of weeks or whatever. We never go beyond a 3-month window. In other words, that's the standard that we believe, looking at the neurofunctional changes that, both positive and negative that occur. We want the clinicians, we want the team to be constantly reviewing the why behind the patient's attendance in your practice. Yeah. And that doesn't mean that there's this fear-based model. It's an inspiring model to say, just what you said, look, I've really come a long way, but I can see there's way more that I could achieve. Yes. And that's very powerful.
Yeah. And then the ones you have who may be on maintenance care, whatever that is, then they see their next scan and they see that it's actually, it's not maintaining, it's actually deteriorating. And then it's very motivating for them to get back under corrective care or more wellness care. So I know it's such a good tool. I know, I think all the coaches in TRP use it. So if it works for us, it works for anyone, right? So
it does. And it's so interesting because you could take away a lot of that anxiety as being, we all had it when we were early on in practice and otherwise, and we didn't know exactly how we were going to communicate the needs of a patient and what we could provide. And this just gives you a starting point, but a continuation. You don't have to make it up. Meaning, and I'm not suggesting we do, like that'd be fallacious, but the reality is that you've got the tools right now to say, I understand now why you keep getting an immune response that isn't working the way it should. I understand now why, your body doesn't heal completely after you've had an episode. It's because there's this chronic nerve tension. We have a plan. We know how to release it. We know how to rebuild it. We know how to get you revitalized. So stick with us. We've got a plan. And they hear that. They know it.
They know it. Yes. One of the big upgrades that you've made, as well as going to iPad versions with bridges and so forth, is you are a brilliant communicator. Everyone knows this, but you have so the ability to communicate the scans is what's really needed, isn't it? So you that's all part of the package, if you like. Is how do you explain these?
Well, it was so exciting because it was so funny because in the early days, I started in 97, so I know exactly where we were going with it. You'd get this colorful piece of paper and you'd hand it to the patient and kind of go, you've got, some issues I got to deal with here. And there was this, they talk about this concept called MIGO, is there my eyes glaze over. And the patient, I get you really are excited about this, but what does it really mean?
What does it mean?
And so, best intentions, right? But when we rebuilt the new software, which is called Synapse, and we said, we in our dream bucket, we said, let's build it to however it was. I was able to build a continuation plan through the core score communication. And so it actually is designed, it has a huge library behind it that looks at all the different iterations of the scores. And it literally cherry picks out a conversation based upon the data that you are observing on the scan. So basically, it allows me to be communicating the results to your patients. And it's really fun to do that. So it builds an individualized report that compares the data from previous exams and then builds a very understandable communication. And then after that, we said, well, nobody understands you anyways, David. So why don't we let educators do the real thing? And so they took that and built it into a very, very condensed but educated model. It's really quite something.
It is. It's very simple. And there's just an enormous amount of resources available to people so that they can communicate the scans, because that's part of the Hawthorne effect. You do need to communicate in a way that they understand, which it's really good at that. Okay. I mean, I know we can talk for hours, but how do people, what's their next step? They're thinking of scanning. They know this is a missing piece. They want to build more retention or attraction or conversion or whatever they want to do. What's the best way for them to get in contact with you?
Certainly, we're a wide open book, but one of the things that they have in this resource is they have you, meaning they have TRP and they have their coaches. So have a conversation initially with your coach, and they're going to direct you towards us anyways. But to bypass the coaches, I'm joking when I say that, but to get directly to us, it's so easy. It's called insightcla.com. And I want to share with anybody who's in here that there's an automatic TRP discount when you start to get involved with TRP and CLA. We're very generous because we love you guys. And so we have very there aren't very many, but we have a preferred alliance relationship. And so anybody who comes and decides that it's time for them to either upgrade or to purchase new, they can be assured that they're going to be getting by far the very best deal that is available on the planet. Which I'm very proud to say. We also offer 0% financing for a 12-month window of time, which I think is exceedingly generous.
It is.
But we love that. And any way that we can get more people scanning and more people engaged in the community of TRP and CLA, we're 100% behind that.
Absolutely. So I know that you are the TRP clients who are in North America or come to the North American immersions. You'll find David there. You can see it there as well. But get in contact with CLA and just do yourself a favor. Basically, this is an integral part of many TRP practices. You're probably in the minority if you're not. So get into it, I reckon. Please, so good to see you on Zoom here. Can't wait to see you in person again very soon. Any thoughts here?
I think we're probably the only partner of the North American crew that actually does the connection with the Australian crew. And there's a real reason for that, is that we have such a passion play with New Zealanders and Australians. We've always had such a relationship down there. For the last 2 years, the weirdest thing is that my calendar has been conflicted on the TRP Australia dates. We're both busy, but mine just hasn't meshed. But I promise, and I mean this on the greatest time, I promise to come and participate down in Australia.
Nice.
So I can't wait.
I can't wait. Well, we'll see you soon. And as I said, get in contact with CLA and get scanning.
Take care, everyone. Bye-bye.
Thanks for listening to this episode of Build Your Remarkable Practice podcast. Remember, what the world needs now is chiropractic, and what chiropractic needs now is more successful chiropractors. If you like the podcast, please subscribe, share with your friends, and leave us a review. And if you'd like to connect with us personally, please click the links in the show notes to schedule a call.